All right, we are live. This is Dr. Michael Kay from the Center for Functional Health, and I'm honored to have a wonderful guest today, Dr. AJ Moyer. He is a physical therapist, very close to where I am at. I had the opportunity to meet him. I love the work that he's doing. So, Dr. AJ, thank you very much for coming on. I've been looking forward to this, learning about what you're doing in the physical therapy world and how you're helping patients move better. So, welcome.
Thank you. Appreciate it. Thanks for having me.
Excellent. So one of the questions I always have when we start with folks is like, hey, how did you start this? Were you, in junior high school thinking, hey, I'm going to become a physical therapist? How did you get here?
Sorry, you broke up a little bit there. What was the question? Just how did I start?
Yeah, the question is like, how did you choose physical therapy? Was that something that you always wanted to do?
Okay. No, I mean, it's not too crazy of a story. I feel like it's a very similar PT story. I was an athlete growing up. I played hockey. I injured my shoulder. One of my assistant coaches was a physical therapist and just like, why don't you come in? Let me take a look. So while he was treating me, I was just kind of looking around, looking at the office and thought it was pretty cool. I kept in touch with him throughout my college career, and he eventually helped me kind of make the decision to go to PT school, and the rest is history.
Gotcha. But after getting out of PT school, then what happened?
After PT school, I got my initial job was with the company I had the last clinical rotation with. So it was an outpatient sports rehab orthopedic clinic. It was traditional insurance based. It was high volume, but it was still like privately owned. So it was really cool. It had like a family feel. Got to know the owners really well. Got to know all the other therapists really well. And then kind of went from there just as a staff PT. Got put up into a clinical director role for a couple years. And then after a little while, I got burnt out from that. Went into home healthcare for about a year and a half. And then made the move into opening our own practice. So now we have our own sports performance PT practice.
Excellent. So you worked home healthcare for a few years, correct?
It was like a year and a half, 2 years. And it was nice a little bit, but then it ended up kind of getting boring. It was a lot of very repetitive, a lot of driving, and just a lot of getting people moving a little bit more. So I just didn't see myself doing that. I've always had an athletic background, always wanted to help athletes. My big passion is helping adults stay as active and into athletics and their hobbies as long as humanly possible. And home healthcare just didn't allow me to do that. So that's what led me to make the decision to open up our own place.
Gotcha. So as the clientele that you saw when doing home health, I mean, what did you see out of that? Like, you say like, okay, I am definitely not going to stop working out. I can't get in this position. I mean, were you treating primarily elderly people? What did you take away from that?
Yeah, it was mostly elderly people. A lot of it's just people coming out of the hospital that were still homebound, whether they were recovering from surgery or illness. But yeah, most of those people were, let's say, 70-year-old and plus. So it was just teaching them to walk again, basically trying to motivate them to move a little bit more, which sounds harder than it is, because a lot of times people get home from a hospital and they're in pain. They've obviously been in the hospital for a while, so they just want to be home and not move. So it was a little chat. It was more so just trying to convince people, like, you can move, the pain will go away. You just have to keep moving, keep going, keep getting stronger. So that was honestly the biggest part of it, was trying to motivate people.
And how many times though did you hit with it? But doctor, it hurts. It hurts when I move. I can't move.
All the time. And that's even still in what we do today. But yeah, in home health, it hurt. Anytime I get up, it hurts. It hurts to walk. And it's like, well, if you don't walk, you're going to lose the ability to walk. Like, you have to fight through this a little bit. So some people are great. And it's like, you have both ends of the spectrum. Like, one side's like, they're just going to walk all day long and then they're overdoing it. But then a majority of the people were like, it hurts, I'm not moving. And then every time I'd see him a couple of times a week, I'd be like, so how many times did you walk since the last time I saw you? Like, well, I got up to go to the bathroom. And then that was it. I'm like, no, you gotta keep moving. You gotta keep moving. That's the name of the game.
It's very move it or lose it, and end of story,
Exactly.
right? I mean,
Yeah.
and
It's an old expression, but it's very true.
It's a good one, and still, again, like you said, always true. So you transition from this home healthcare, and now you're into more of this sports performance, and you work at a very cool place. So you have like a whole almost like CrossFit gym that's available to you, so you get to use that, which is really nice. So it says sports performance, but it's more than just sports performance, because you see people who are not playing sports, who are just really injured and looking for something different.
Correct.
So
yes.
when you're, can you talk about, like, it's not just about athletic performance?
Correct. Yeah, and it's not just about working with people who are injured. So the traditional PT route's super reactive. It's you get hurt, you do PT. We want to help people that are young athletes. We'll work with anybody, pretty much like the youngest would be around middle school age on up. So if you're an athlete that's been struggling with like hip tightness, you're not necessarily injured, but it's impeding your performance, like that's something we can help you with. There's always going to be the athletes that get hurt. So yes, we work with a lot of injured athletes, help them rehab, get back to not even just where they were, but beyond that. So like, you don't want to just train somebody to get out of pain. Like that's not when the issue's resolved. When pain is gone, that's great, but that doesn't mean that your strength is back, doesn't mean your mobility's back, doesn't mean that those movement patterns you have to do for your sport are back. So that's where we really help athletes get beyond where they were before, so that they're super confident going back on the field. But other than athletes, we work a lot with active adults as well. So we have an office inside of a CrossFit gym. So we see a lot of CrossFit people, just gym goers, a lot of middle-aged to getting up into their 60s, even 70s, that are still very active. They want to golf, they want to go hiking, they want to jog, run marathons, and they're getting injured, or they're having these aches and pains that they just can't get rid of on their own. So that's where we come in. We're very activity specific. So if you're training for a marathon, say, and you're not doing the specific strength training that translates to running, so like a lot of single leg strengthening, single leg stability, it's not going to translate to being able to get back to your activity. So that's the big difference with how we operate. Traditional PT will preach that's what they do, but then they'll just throw you on a machine or give you to an aid, and they just run you through the same old program. Yeah, you do the hand bike, you get on the treadmill. Right? Yeah, you get on the treadmill for 10 minutes, you get stim and heat, and like none of that stuff actually fixes anything. It's just they're just billing codes. So we're very much about working on the issues and helping people not just fix them, but like teach them, this is why this happened, this is how you fix it, and then when you're done working with us, this is what you do to continue progressing things so that you can keep training for those marathons or get back to pickleball or whatever their activity is.
Right. So I want to break down two things. I want to break down like what you're seeing like for the middle school year injuries, what you're seeing in high school, what you're seeing in college. Obviously, it's sports specific. So if we run down the line, I mean, football, soccer, and baseball is big in the junior high school years. You yourself, you played hockey. So what are you seeing that comes in more in that middle age years? Are you seeing those concussions? Are you seeing the low backs, the shoulders? And again, I understand it is sports specific, but what do you see?
We've worked so far with we've seen a good amount of soccer players, some cross country. We've worked with some hockey players as well. Believe it or not, we've worked with some like martial artists that are on the younger side. Soccer, it seems to be a lot of knees and hips. Swimming is a lot of shoulders. Martial arts is everything, but more so like neck and shoulder is a very typical one we see as far as pain. Hockey player I just recently worked with is playing over in Europe and had a torn groin that he was recovering from, so had a couple setbacks. So hockey's pretty specific for a lot of hip issues with hockey players just because of the stride, and for goalies just the lateral movements that they do. But I mean, those are the most common ones as far as like injuries go for middle school or into their teens. Women, you see a lot of ACL tears with soccer players. So that's the other side of things with especially younger athletes is we want to not just get them when they're injured, but teach them like these are the really important things that you need to be training and show them how to train properly so that the young girls are less likely to tear their ACLs or that young hockey player is less likely to get hip impingement or hip issues because they already know how to strength train and keep their mobility where it needs to be so that they can stay on the ice or on the field.
Yeah, I mean, I can tell you, like, we've always seen, like, with our martial artists, like our Taekwondo folks, they've always come with elbows and knees because of the repetitiveness of their kicks and throws, their punches, right? Yeah. And then our judo folks, like judo and aikido, hapkido was always the hip pointers because of the hip throws. You know, so it's interesting when you look at martial arts, and I love the physics behind it. They have almost that same kind of joint they come in with, like, you know, you tell me the martial art you practice, I'll tell you the joint that's kind of, you know, curmudgeony.
So for sure.
We did see a lot of that. I find it interesting that most people don't realize how physical therapy can be helpful when you're training for a competition, right? So everybody thinks, oh, I wrecked up my ankle, my knee, my hip, the shoulder, I got to go see the PT. And in my world, I can tell you, because we do a lot of manual medicine, especially when I was in California, it was like, no, this is something you should see the PT while you're training. This is part of training. And I wonder if you can speak about that a little bit, because I think people kind of wait until there's an injury and then I'll go. And you're like, from a practitioner perspective, oh, God, if we just seen you like 4 weeks ago, you'd be doing a lot better.
Yeah, for sure. And that's what a lot of the people we work with come to us when they're injured. But then once we get them better, we get them on a wellness program where we will see them like once a month. And the point of that is as they're training and we're helping progress those programs and change their programming is we're keeping an eye on, all right, are you developing a little bit of rotator cuff weakness? Is that hip getting a little tight? Okay, it is. We need to change your programming so that we're addressing those issues. So we're catching things before they turn into an issue. They're not likely in pain at this point, but it's things that if they address, then they're going to be way less likely to develop pain or develop an injury. So, yeah, I mean, I'm obviously a huge proponent. I'm biased because I am a physical therapist, but if somebody is training, I mean, there's a lot of good personal trainers out there. There's a lot of bad ones as well. That can be said about PTs, chiropractors, but I think people's brains go to, if I'm not injured, I got to go to a personal trainer. But I mean, that's the performance side of what we do. Again, different than traditional PT, insurance-based PT. Insurance isn't going to cover that. You're not injured, you're not in pain, you're functioning, but you may not be where you want to be performance-wise in your sport. And that's one thing that we pride ourselves on is we don't just talk the talk, we walk the walk. Like there's a lot of different exercises that I'll show people that, like, if I can't do it, I don't expect my patient to be able to do it. So like we're in there with them, we're working on these things. And between myself and Dr. James as our other treating PT, we both have an extensive history in different athletics. So like we know what their bodies are going through and what they need. And like a personal trainer may not have that same thought process of maybe they did play sports, but they're not thinking the same thing as I am as far as like, all right, this guy's in jujitsu, his shoulder's getting wrenched on all the time. Like we're not just trying to think how much we can push press. Like we have to build the stability in that shoulder so that he's able to withstand the forces of all the different things he's going through.
Right. And I totally agree. And you'll get pushback though, like, yeah, but I'm going to go to my athletic trainer because the athletic trainer knows. So how do you create your dialogue around that? You know, we talked about personal trainer. That was going to be one of my statements. And I was like, okay, but the athletic trainer, I found like, you know, when I was working with sports people in chiropractic school, you have your chance afterwards to go, you can get like a graduate degree in sports medicine, get a graduate degree in rehab and neuro and ortho. I geared mine towards rehab. And of course, I was watching all my friends who were going to sports, and I was like, wow, they're fighting with the PT, they're fighting with the athletic trainer, they're fighting with the coach, they're fighting with the parents, they're fighting with the athlete themselves. So it's
Yeah.
always difficult. It's like, and all you're trying to do is help this individual, right?
Yeah.
So how do you couch around like, hey, we're different than the athletic trainer, and when we're different than the personal trainer?
Yeah, it can be tough sometimes because no matter how much you explain the difference between all the different people out there, they're at the end of the day, they're going to go to who they want to go to or who they trust. So, I mean, I try and explain it from a movement standpoint. I don't see anybody better to go to than a physical therapist, especially a performance PT. We know, like, that's what our training is in, is movement patterns, strength, mobility. We know more than anybody how to fix things and how to assess things. Now, athletic trainers, personal trainers, they have this. They can say the same thing, that they're trained in those things, but it's not nearly to the depth that we are. They're not going to be able to pick up on those little nuances where those movements are changing and know what is the issue. So, like, for example, if somebody is doing a push press, if they're a power lifter or a competitive lifter, and they're getting shoulder pain, the athletic trainer, the personal trainer will probably just look at the shoulder and be like, you have shoulder pain, you have a shoulder issue, let's just decrease weight, or let's change how you're moving a little bit. The real problem is likely it's either coming from the shoulder blade, could be coming from the neck, could be coming from the thoracic spine. So, like, those are the things that other like personal trainers, athletic trainers aren't necessarily going to pick up on. And honestly, a lot of PTs probably wouldn't pick up on it either, believe it or not. But a lot of times people get so dialed into pain's right there. That's where the issue is. So.
Right. And we see that in the office, because we'll do that full functional movement kind of stuff. And like, what were you doing? Well, I got muscle stim. I went 3 times a week for 8 weeks. I'm like, okay. I'm like, anybody watch you squat, lunge, put your arms over your head, get off the table, right? So it's just, they totally miss that. And again, I think also because they're stuck, right? So they have to do what they're told to do, and like you said, they got to make the billing.
For sure. And a lot of times people will like when they're like, well, I've been working with my athletic trainer, I've been working with this personal trainer. Be like, oh, how long have you been working with them? Oh, 6 months, a year. And like, how's it going? Like, well, I still have this shoulder pain. I'm like, well, let's try something different then. Like, let's see what we can do for you.
Yeah. We had a patient the other day treating his wife, and he's like, hey, I've been seeing this physical therapist for the last 3 months for my shoulder, and it's gotten better, but something's still funky. I'm like, did they manually work on you? Nah, not really. So resistance bands? Yeah. Ice? Yeah. I'm like, does it hurt here? Yeah. I'm like, you need somebody to look at the whole person, right? And and like you said, right? So it's his shoulder, and we'll get a little bit sciencey for some folks. It was the infraspinatus teres minor. Scapular movement was not there. He had a little bit of the forward head posture. I'm like, hey, you got to get this whole person, the whole skeleton work on, not just this one thing. So, I am a big proponent of your thought process. You have to look at the whole person, and it's not just an ultrasound, right? So I think that's really, really important. One of the sports I want to talk about, I do not play, but I love from a biomechanical perspective, is golf, right? So we'll see some golfers. We'll hear some of the complaints. I think every golfer should be working with somebody who does something in manual medicine. If you look at all the professional golfers, they always have somebody there. I mean, a good colleague of mine, buddy of mine, he worked the PGA Tour. He's like, everyone's getting treated. All the professional golfers are getting treated. They go around with their physical therapist, their chiropractor, and they get treated. And that's how their golf game actually becomes better. So I want to talk a little bit about golf. I mean, if you think about a movement where you go 0 to 60, and even with good technique, you cross every joint, right? It's absolutely amazing. So, but a lot of open injuries that happen. So what other golfers you see? Do you see more it's the lower back complaint? Do you see it's more the shoulder complaint? What do you see in your practice?
As far as injuries go, we would get a lot of elbow, like golfer's elbow, or medial epicondylitis. Yeah, and then you get a lot of the back pain, stiffness, or throughout my back, and then shoulders, just shoulder injuries with it as well. So injury-wise, that's what we would work with. But then a lot of times people do come to us for golf performance. Like they're not injured, but they feel stiff, they feel fatigued after a round. And that all circles back to, it's a Scotty Scheffler quote, that most amateur golfers or just everyday golfers or once a week golfers, they just don't have the physical ability to actually perform a golf swing. Like they don't have the mobility, they don't have the strength, they don't have the form. So I always say, like, I do not teach how to swing. I'm not a swing coach, but I know more about mobility, movement, and strength than people who are swing coaches. So we work on functional movement patterns in a golf position that improve mobility in all planes of motion so that people feel better and they're able to get into a more natural golf swing without having to force things. That's where people are going to start getting impingement in their shoulder because they're trying too hard to get into a backswing. Or if they don't have the full rotation to get into a backswing, then they're trying to swing too hard into their follow through, and then they're throwing their back out because they don't have the rotational strength to be able to control that movement. So those are the things I love working with. I mean, I love golf myself, and being able to help people learn about how to move properly through a golf swing and how to do exercises that support that. That's like one of my favorite things to do.
Cool. So let's talk about that person who comes in. If you can, walk us through like what it looks like. They come to your office, they're a middle-aged guy at age 47, they're golfing, and they say, hey, listen, I'm swinging. It's not going well. Shoulder is killing me. Low back is not my favorite. And the inside of my ankle is bothering me now, right? So can you walk us through what it looks like when they come into your office? Because I know when they go to other offices, it's kind of like, lack of better terms, like, not a great exam. It's an okay exam. So I wanted you to share, like, what it's like going to your office. What will happen when they walk in through that door?
So I think that's one of the coolest parts about how we operate is since we don't have to appease insurance companies, we're not just like taking range of motion and doing manual muscle testing. Like I want to see people swing. Like if you're having pain when you're swinging a golf club, bring your golf club in and I want to see you swing. We'll go outside. I have a hitting mat in the gym and a simulator. We'll set the simulator up and I want to see you swing and see what's going on. Well, it's nothing super high tech, but I'll ask them if I can take a video of them or I'll use their phone. I'll do a slow-mo iPhone video of different angles of their swing. And then you can point out, like, see how your knee is caving in here. That's because your hip's weak or your mid-back's tight. And then that pain translates down to your foot. Now your foot can't move. So we use the movement pattern to guide what we look at. We're not just measuring your ankle and saying, oh, your calf is tight. You got to stretch that out and then go golf. That's not how things work. Our bodies are all working together. So if our ankle's stiff, that's going to affect our knee. If our knee's affected, then that changes how our hip moves. If our hip is changing the movement pattern, it's going to affect our rotation. So everything goes together. And if you're not looking at all those pieces as affecting each other, then you're missing the whole point.
Gotcha. So I find in my practice that often a lot of people they can't rotate. Like rotation is not great, and most people don't train in rotation either. And I know for the longest time, like, oh, you shouldn't train, or you're going to shear the joint, but it's the exact opposite, right? So we find that training in rotation is very helpful. So of the golfer that you see, so let's go to the shoulder, right? So let's talk a little bit about the impingement syndrome and rotator cuff, right? So other than going to ortho, getting, the cortisone injection, how are you looking at the shoulder? I know you do the functional movement, but what is it that you're doing to actually help that shoulder?
More times than not with impingement, honestly, a lot of shoulder injuries comes down to poor posture and weak scapular muscles and stabilizing muscles, so rotator cuff as well. Anytime, today's day and age, a lot of computer time, a lot of TV time, a lot of time in the car, everything just gets rounded forward. And then that changes just the rounded shoulders. That's changing the positioning of our shoulder blade. It's forcing our thoracic spine to be more curved. So over time, if that happens over and over again, then all those joints are going to just adaptively change to be in that position. So then when you do any movement with your shoulder, your golf swing, it's not moving efficiently. The muscles that should be working and supporting it aren't doing it. Other ones are taking over. So what we do to address it more times than not is you have to strengthen those little tiny stabilizing muscles in the back and shoulder blade area, which is going to provide a lot more support and movement for the shoulder itself. So that's going back to what we were talking about earlier, Dr. K, of like, just because your shoulder hurts and there's impingement in there, there's so many other things that have to be addressed to fix it, that it's you have to look at everything. But the big difference I always try and really hit home for people is I'm a huge proponent of stability. Like, you're not just getting stronger. Like, strength and stability are different things. Strength, I can just like throw a ton of weight over my head, but to be able to control that movement is a totally different story. And building stability in your joints is where you'll get that pain relieving long term.
So I can't just use a Theragun on my shoulder and have it go away? That's
No, don't even get me started on Theraguns.
No, come on, man. Theragun's good for our practices. What are you talking about?
Everybody's like, can I use a Theragun? I'm like, go ahead. I'm like, I don't think it's going to do anything, but it feels good. Have at it.
Between the Theragun and the Tension I got off of Amazon, I'm A-okay, buddy.
Yeah, tell me about it.
Right. So that's funny. All right. So, let's talk about that shoulder person. So you got them through that initial phase, right? So the shoulders function better, thoracic function better. We got better scapulothoracic movement, right? We've increased the rotation of the cervical spine. Their swing has improved. What can they do now to maintain that, right? So, I mean, you have the whole gym saying that's great. What can they do at home to really maintain that?
Yeah, so that's another big differentiator for us is we help set people up long term. It's not just like pain's gone, good job, see you later. We help set people up on a workout program. The programming that we use, we set people up with an app where we can put each individual exercise on any given day where we want them. Like, if you were my patient, Dr. K, I'd be like, all right, here's your Monday workout. Here's what I expect you to do Tuesday. Here's Wednesday. And we just program that out for people. So they always have something to reference to, and they have access to that stuff all the time. Accessibility is another big thing for us, is especially when they're working with us on like our wellness program. We're always accessible. Text us, call us if you're having issues with your programming in the gym or your workouts maybe get a little stale. Then we help program like personal workouts for people. But what we do to maintain what we fixed originally is to make sure that we are incorporating those like foundational types of exercises so that once they gain that stability in their shoulder, they don't just go back to throwing that overhead press in as heavy as they can get. We still incorporate those stabilizing type exercises into their workout.
Gotcha. And if you had to pick like one piece of equipment for them to have at home for the golfer, what would it be?
For golfer?
Yep.
There's a lot of stuff that we do with the type of program I am certified in where you just need a dumbbell, probably like 5 to 10 pounds. There's a ton of stuff we can do with that. And that'd be about it. Maybe a medicine ball. Again, maybe 10 pounds, 15 pounds, but it doesn't take much. There's not much.
No, I agree. I'm a huge kettlebell fan. I don't know if you guys like kettlebells.
Oh, yeah.
So the first thing I do, I make all my patients do a Turkish get up.
I love them. Yep.
Yeah, it's such a great exercise, right? If you're left to do, I would say, like, if I'm stuck with one exercise,
yep,
can't beat the Turkish get up.
I love teaching people those because they're like, what do you want me to do? And they're like, how'd you do that? And then they realize even just holding like what appears to be a light weight, and then you go through it and you do 2 or 3, your whole body's burning.
And your heart rate goes up too. It's really just a powerful exercise. You talk about like, what do we need to do to combine stability, mobility, the core, the strength. I mean, flexibility as well, if you want to talk about. But I mean, I think it's just like a wonderful, wonderful exercise. I know it's not VO2 training and stuff like that. I know we're not zone 2 and all that, but my gosh, what a great exercise even without any resistance.
Yeah, absolutely. I agree.
Where does the act of weightlifting resistance play a role for your golfers?
It's huge. I mean, any sport you need to be strength training in. Running, a lot of runners we see don't strength train barely at all, and that's where we see them get injured. So golfers need to strength train just as much as any other athlete, but it has to be specific to their sport. So if I have a golfer come in, I'm not going to have them deadlift heavy weight. That's going to be counterintuitive to what you're trying to accomplish. When you're deadlifting, you want to create neutral spine stiffness. Golfer doesn't want that. They need to be able to have the flexibility and the stability to be able to do a swing. They don't need to have a stiff spine. So we would focus on teaching proper core engagement and using hips and core to drive rotational movements so that it's more so going to translate to better performance, less fatigue, less likely to get injured, and be able to hit the ball further, less pain.
Right. So one thing you did mention, gear our conversation towards tech, is that you do use an app sometimes to help, I guess, assess posture or watch the movement and stuff like that. Where else do you use tech to help you?
So we're fairly low tech. I am not a huge believer in modalities like stim, ultrasound. It can feel good, but I do not believe that helps fix issues. We'll use, really the only tech we use is we will use phones to video movements, squatting, lunging, hinging movements. We'll videotape people running or swinging a golf club, because that's really powerful then when you can show people, and all those are mostly in slow motion, you can show people where their movement's breaking down. A lot of times they have no idea. They're like, I had no idea I was shifting to my right when I was squatting. And then you use that to explain why it happens. You're like, well, you're shifting to your right because your left hip is impinged, so you're trying to clear space, and you just go down that cascade. But for golfers, we do have a simulator that goes onto our phone. So when we're doing the golf program, I'll take metrics before we start the program and then at the end, and people can watch their drive distance and their iron distance increase by the end. It's not just drive distance, but ball speed, club head speed, smash factor. They all relate together as far as energy transfer, which is all of what we're trying to create with the types of exercises we're doing. That's probably about as high tech as we get using a golf simulator. But for the most part, you can have as much, in my opinion, you can have as many modalities and cool treadmills and whatnot. But if you don't actually teach people how to stabilize their joints and strength train properly and move properly, meaning proper squatting, proper lunging, proper hinging, proper overhead movements, then all those fancy like tools and toys aren't going to do anything long term. It'll help them get out of pain, but if you don't teach them how to move properly or use the right muscles, then 6 months, a year, maybe it lasts longer. 5 years down the road, then they're eventually going to run into the same issues.
Yep, agreed. And what role do you feel cardiac training for your golfers play?
Like cardiovascular training?
Correct.
Yeah, I mean, it depends what level. I mean, if it's just the beer league player once a week for 9 holes, probably not much. But if it's a more competitive player where they have to walk a course, then that fatigue factor definitely sets in. So some of the exercises that we show people, if they saw a video of them, which we do have a YouTube channel, you can look up some of our golf exercises. They don't look like much, but my God, they get your heart rate up, especially as you increase reps a little bit or even just increase weight a little bit. So just going back to the functional type of training, like I wouldn't have my golfer running 10 miles or doing sprints, but more so training to get that heart rate up in a movement pattern that they would typically do.
Excellent. Yeah, I can see, I don't want them running long distance because it just hammers the joints a lot. Yeah. Big fan of the jump rope. I think the jump rope's great to get that cardiac going for sure. I think that's
absolutely
very, very helpful. So when we start looking at PT as a whole, where do you see your industry going, and how are you going to do something different than where your industry is going?
I think we've started doing something different. I think we're in the middle of a transition from a traditional insurance-based PT clinic to more cash practices starting to pop up. I know there's a couple around, like even down towards Philly, but there's not many. But I think that's where the trend is going, because PTs themselves see that people don't get better in the traditional insurance-based world. It's too high volume. You don't have the time to actually spend learning how somebody moves, or maybe can take 10 minutes and I can see that your movement patterns off, but then I don't have the time to actually teach you. So I think that's where it's heading. I don't know where AI is going to come into play in the future. I don't think anybody does, but I know there's talks of it, like being able to help diagnose, like at some point, just being able, if you came in with shoulder pain, to be like, here's what Dr. K says his symptoms are and what hurts, and it's going to spit out like a diagnose. I have no idea how that's going to play into the future, but I mean, I no matter what technology comes in, I just don't think I'm going to ever change my philosophy of you have to learn how to move properly, and no amount of technology is going to be able to teach you that. You can read it, but you're not going to be able to then translate it. So
Yeah, I still think there will be this hands-on movement, human touch that will continue if the person wants, a good outcome.
absolutely.
I mean, we battle with AI all the time. I think I shared a story with you. One of our patients, came in and said, they called me on the weekend. They said that they're in metabolic acidosis, and I'm like, based on what are you on ChatGPT? Get off that. You're fine. We're not having this conversation, right? And one of them said, we look at one of the cardiac lipids we look at is like HDLs, the protective cholesterol, and you want it greater than 39, and this person was up to 59, and the ChatGPT told them like, oh, it's beyond the reference range. It's how they want you to get it down. You're like, no, it's. So we're not there yet, but I don't think we're too far off. I can definitely see where it can, a large language model kind of scenario will, just like the apps are doing now, assess that golf swing and tell you where your, weaknesses may be. But I still think it's not going to be able to do what you're doing. I'm pretty confident it's not going to happen, right? And if it does, it says, okay, how do we go ahead and fix that? All right, well, we're doing one thing. Now we have this other underlying problem, so you still need, your skill set to actually create the difference.
Yeah, I agree. And to your point, like I had a patient come in this a while ago, probably like a year ago, and he had back pain. And he's like, well, I watched this YouTube video, and this guy was having pain deadlifting just like me, and he did these 3 exercises, and then his pain was gone. And I'm like, that's the video. That's not how the real world works. Like, yes, they are good exercises, but it's not magic. So I think, I mean, I don't know where technology is going to go in the future. It's going to get better, but I believe that you need the human touch. You need the manual therapy in conjunction with learning how to move properly. And that's where you're going to get long-term results.
Yep. Agreed. Cool. So if you can share with us, a case that comes to mind, somebody come in with X, Y, and Z, and if you can share what you did when they came in, because again, I don't think a lot of people understand what like a functional movement screen actually looks like. I don't think they get like, it's more than just put your chin down, look up, turn and turn, right? So if you can share what it's like when somebody comes into the office or filling out paperwork, obviously, and all that kind of stuff, and then what metrics are you looking at? What does your exam look like that's different from your traditional, PT?
For sure. I could kind of use a case study if that would help. Almost. So I had a patient come in who had ankle pain, saw a podiatrist, and told him he should never run again, never do martial arts again. And this guy was probably early 50s, had a 12-year-old daughter, and all he wanted to do was run with her, do martial arts with her. So he came in, and so ankle injury, so pains at the ankle. We start there. We start at the foot, see how his foot posture is, and work our way up. So we watch him run, we test strength from ankle all the way up through his core. And what we found was his hips were very weak. So his ankle pain was present. And what we came up with was that his hips were very weak. So anytime he was running or like martial arts, like pivoting on his foot, there's no stability in his hips. So then that gets translated down the chain. And that's what was causing the pain in his ankle, almost giving it like a severe impingement. And I mean, he responded extremely well right from the start. He was back to running, back to martial arts, had no pain. So I don't know who the podiatrist was. I don't know if he was lazy or if he just thought like, man, it's not worth the time. But if you're, again, going back to where the pain is, like the functional movement screen, what we do is you got to look at the whole body. Like you can't just look at the ankle. So if you look at the ankle, that's all you see. If you zoom out and look at the whole body, I mean, his hips might be shifted. One might be dropped. He might, as we do our strength testing and functional strength testing, one glute might be firing, one hamstring might be firing on the same thing. So if muscles aren't doing the job that they're supposed to be doing, then the body's not going to work efficiently. And then all that pain just resonates to typically a place or multiple places. And his was in the ankle. So we did full core on down type strengthening, and it worked extremely well.
That's great. And then when you were evaluating him, are you looking at a particular movement? I know you look at a whole bunch of movements, but like if you can share with us, like you look at the squat, you look at lunge, you're looking at a rotation, you're looking at how he gets above. What are you doing that you see? Because again, the typical visit is, touch your toes, lean backwards, all that. So I want you to share like what you're actually doing when you're seeing them for that functional movement.
For sure. So we typically, example of a runner, we'll typically go out and watch them run. And then anybody, like some of my go-tos that I almost always look at, just because it gives me so much information, is watching them squat. I watch them squat facing me from the side and then facing away from me. And you can really see, like sometimes from the front, it doesn't look too bad. And then as soon as they turn around, you can really see a shift. And that's just a ton of huge information for me. A test called a step down test doesn't sound like anything crazy. It's not anything super crazy, but you just have somebody stand on a stool about the height of a step, hands on hips, and try and tap the floor with one heel and rise. And it gives so much information as far as if their knee caves in, if their hip drops, if they don't have ankle mobility, you'll see their heel pop up on the step. So things like that, relating back to like an insurance-based clinic, it's like they just want to see what the score is. I'm looking at that as the full body of like, all right, that right ankle is super tight, that heel came up, that's likely why that knee is caving in, and weakness from the hip. So there's so many just functional tests, and just watching how somebody moves and having the time to watch how they move, that basically tells the story. So those are two of the biggest ones I do, is watching squat and the step down test. If they're a little bit higher level, I like doing like a 3-hop test and seeing how far they can jump on one leg 3 times compared to the other side. And that gives a lot of information as well. But a lot of it, very common things that we see is a lot of knee caving in with some of those exercises. And then people think, oh, it's a problem in my knee. That's always coming from the hip. So that hip's unstable, it's weak. The knee's reaction then is to cave in to try and just compensate for that. And that's usually a huge one that we see.
Yeah, I'll tell you, I'll ask people like, hey, can you hop on one foot? Like, yeah. And they try like, oh, damn.
Yeah, right. Yeah, no problem.
They can't. It's sometimes it's like, all right, just stand, bring your knee to your chest, hold. Oh, I got it. Nope, I got it. Nope, no. Oh, God, I don't have it, right? So It's really interesting, those simple kind of movements. They just don't have. Everybody doing balance work twice a day with their toothbrush. So they put on the electric toothbrush. It's 2 minutes. And for 2 minutes, they do balance in the morning. They do it 2 minutes at night, 7 days a week. That's 28 minutes for a whole week. Didn't take anybody's time away. Because, again, like we said, it's a very user-lose, especially balance, right? So that's really, really important. You have 2 other DPTs that work with you, 2 other docs. Can you share, what do they do? Do they do anything different than you do? Is everybody doing kind of the same thing? What are your hours like?
So we have myself and Dr. James is the other treating PT. My wife is also a PT, and she does a lot of the back office stuff for us as well. As far as specialty goes, I mean, Dr. James and I both specialize in athletes, active adults. As far as athletic background, like I grew up playing hockey, golf. Dr. James is huge into rugby, and I mean, he's played a number of other sports as well. He wrestled. So that's what I was talking about before, as far as like between both of us, we basically played almost every sport and have very good understanding of the mechanics of everything. But as far as treatment goes, I mean, we both can treat anything. I wouldn't say I have one specialty over Dr. James, except like the golf program. If somebody's a golfer coming in, I would work with them. But as far as other sports, other injuries, we're both well versed in anything head to toe.
Excellent. And if we project outwards 5 years, 10 years, where do you see your PT business going? Where else do you like to get into?
Yeah, I mean, the plan is to grow. My wife and I, when we started the business, had kind of two missions. One for the patients, to give them the actual care that they need. I'm sure you had one very similar. And then the other one for us was from the PT side of things, is we want to help save as many PTs from working in a mill as possible in the insurance world. So we want to grow. We want to have other offices. We want to help other PTs be able to treat people the way they want and be able to work with people one-on-one, because we know that that's how people get better, and we know that PTs enjoy working that way better. So the goal is to grow. We don't know. I mean, our initial goal right now is to get our own space at some point, and then kind of go from there. But we definitely have a vision of having a few different offices, at least in the future.
That's fantastic. It's really beautiful, and I hope you guys do that for sure. We need more of this than the upper body ergometer, right? And then one last question: what could you share with us? Like, if we wanted to listen to like a good podcast or a good book to read that's kind of geared towards your thought process with functional movement and getting stronger as a golfer, is there anything that you can recommend?
For health in general, our philosophy lines up a lot. I love listening to Dr. Peter Attia. He's huge on longevity, and he is a huge proponent of strength training and exercise and how beneficial that is for health and not just taking medication. So I listen to him all the time. There's so much good information and resources that he provides. It's awesome. I'm super interested in like the longevity stuff of like how you can do a dead hang for 2 minutes means that you're going to live longer. The likelihood of you developing disease is 60% less. I don't have the exact percentage. That was just an example, but that kind of stuff is so fascinating to me. The physical strength metrics and how they relate to longevity is huge. And that's the message we want to portray to people of like, if you start working out now, we don't expect everybody to like be deadlifting 1,000 pounds and running marathons, but if you just strength train, if you take care of yourself, like you can live a good life when you're older. You're not going to live a wheelchair bound life for the last 20 years of your life. So that's what the message we want to get out to people. And Dr. Peter T is a great one to listen to.
Yep. I agree. T is great. Huberman's great. A lot of these guys, I think, really give a wonderful presentation. And then I think as practitioners, we have to help our patients take that information and learn how to apply it to their world, because not everybody's going to get, an ice bath. Not everybody's going to be able to get out for a 2-mile walk every day, and not everybody's going to be able to throw in a rucksack, all that kind of stuff. So we gotta get it down to where they can do it, right? And that's why, we do a lot of these like, hey man, I just need to do this like 5 times a day, just 5 reps, 4 reps, 3 reps, 2 reps, 1 rep, and then do that 3 times. We've been getting some wonderful results with like the 3-2 principle of walking, where you just walk for 3 minutes regular pace, increase it for 2. Please do 3 rounds, 15 minutes. You're good to go. Yeah. And if I can get that every day, then we're winning. That kind of stuff. So, great info today. I really appreciate your time today. Thank you very much. Is there any parting words you want to leave us?
Thank you for having me. I really appreciate it. This was my first podcast interview, so hopefully cool. I provided a few good tidbits of information. But just leaving it for all the listeners. If you ever have questions or anything at all, you want to pick my brain, you can give us a call. We always do free consults. So if you don't even know if you're a good fit, just give me a call. I'll point you in the right direction, and just want to help as many people as we can.
Super. And before we leave, I know you have a special going to October 1st where you're doing functional, like kind of movement screening kind of deal. If you can talk about that and talk about like where you're located and how they get to you.
Of course. So we're located right in Telford. It's right off, we're probably like a mile off the Souderton exit on 309. And yes, for the month of September, we're running a special on our functional movement screen. So you get a score that basically tells you information on where you stand as far as strength, mobility, and balance. And then we will educate you on your score, what you need to do to change in your workout program to start addressing this. And then we will give you things to work on. So that translates very well to, there's like research to back that up as far as injury prevention. So if your score is out of 21, if your score is 14 or below, then you are more likely to be injured. So that could be, it's more so geared, that score towards an athlete, and then the scores can be adjusted for just active adults as well. So it's a great measure to get into and to know, because it's really what we want to do is kind of create almost like an annual physical for people. People go to their PCPs for the annual physical, check the heart rate, check the breathing rate, make sure they're exercising, sleeping. And I almost feel that this type of physical is going to be more beneficial, because it's going to show people like, whoa, I thought I was strong, but I need to start moving more. I need to start exercising more. And that's where we can then help guide them.
Yep, that's beautiful. Thank you. And just one time, your telephone number?
Our cell phone number is 267-281-4377. You can also look us up on Google, just Gear Up Physical Therapy. We have a website you can check out as well. But like I said, anything, you can email us, phone call, whatever works for you. We'd love to help anybody.
Excellent. All right, just hang with me while I wrap up here. So I want to thank you personally for coming on. That's great. Everybody, this is Dr. K with the Center for Functional Health. If you have any questions, please reach out. We'll talk to you soon.